Commissioner Anurji, on behalf of organizing team, pleased to offer you all a warm welcome to Season 2 of College Katta. College Katta is a Marathi term that roughly translates College Corner or College Gathering. It's an informal event where students, alumni, faculty members come together and share experiences, stories, and knowledge in a relaxed setting. Our guest for today needs no introduction. Dr. Kakrani Sir is Director of Academic Collaboration at Dr. Patil Medical College and Research Center. Sir has dedicated over 5 decades to the practice of advancement of medicine. His extensive contribution to the esteemed medical textbook, Davidson Principle and Practice of Medicine, and Hutchinson Medical Methods have been invaluable, solidifying his reputation as a leading expert and educator in the medical community. Sir's commitment to the medical education and tireless efforts in shaping the future of the healthcare are truly inspiring. We are privileged to have him here with us today to share his insights and experiences. Please join me in welcoming Dr. Kakrani Sir. Now, I would like to request Dr. J.S. Bhavalkar Sir, Dean Dr. Patil Medical College, to felicitate Dr. Kakrani Sir. Thank you, sir. Sir, we are eager to hear from you. Could you please share a few words with us? Following that, we'll proceed to question and answer session.
I think really thankful to you for giving me an opportunity. That too at number 2 after Dean, I think I feel honored. So I would like to share my experiences. If I'm some use to you, I call my day successful day.
Everyone can ask their questions. It's an informal session, so you can ask your formal and informal question and whatever you need to ask.
Sir, could you share with us about career medicine?
I think it's a long career, 50 years.
Yes.
I started my residency in medicine in 1974, February, when most of you are not even born. So, I think till 2024 is a long journey, almost 50 years. More than 50 years now that I'm in medicine. So I think there could be one incident that I can share.
Yes, sir. One of your most memorable one, which has really motivated you.
So I decided to be medicine long back because I realized I'm not poor at maths. So I took biology, and in biology I was successful. I was the topper in my batch in the school, and that took me to the stream of medical college. Of course, there were a lot of ifs and buts in the process. I think when I was to join medical college, my father retired. He was to retire at 58. The government changed him. He retired at 56. So the question came, should I join medical college or not? That was the first biggest experience of my life. So we discussed and we thought, if not medical college, I think I can join agriculture college. And I had taken admission there because there was no fee structure involved there. But looking at my face, my father realized that this is something which is possibly, he is not happy. So he met the principal of degree college, where he had to do BSc Part 1 before going to medical college. There was no 10 plus 2 stream. So he met the principal whom he had known. So he told that this boy has higher marks than anybody else admitted in the degree college. So I'll give him admission. I think he can, if he has to go to agricultural college, he can go next year also. So I took admission in the BSc Part 1. Obviously, I passed with good marks. And by the time something good started happening, I had a letter coming from Government of India that you have been awarded National Merit Scholarship. So that made my way to medical college. The rest of it was easy. So I entered medical college and I finished my MD somewhere early 1976. I entered medical college in 1967.
Thank you, sir.
Good evening, sir. Having seen 5 years, 5 decades of experience, over these 5 years, you must have experienced a lot of change in medicine. And how do you feel it has impacted the patient care, and how do you feel if there's any difference in medical education?
So it has improved the patient care significantly, but possibly it has killed some clinical skills. We are largely now depending upon the laboratory results for a clinical diagnosis. But I have seen and witnessed this. When I joined as a resident in medicine, what was there in my hand? The clinical history in detail, which we used to spend almost an hour or so, followed by X-ray chest, ECG, and 4-5 tests like blood urea, blood sugar, and that's all. And we had to give diagnosis on 4-5 biochemical tests and 1 ECG, 1 X-ray, and most of it history. So our diagnosis used to be largely on history and supported by some lab tests, which were helpful only in 10 to 20% of the cases. Over a period of time, the science evolved so much that when I retired in 2020 January, my resident used to give me everything in my hand next day in the round. When I came here, he used to tell me history in 4 lines, but used to give me an X-ray chest, CT scan report, MRI report, ECG, all cardiac enzymes, all biochemical tests, serum electrolytes. So my job was easy. I asked him, what is your diagnosis? He told this and this, so I agreed with him, because most of the time I had to agree because things were already in my hand. So this transition is a long way. I think because of my age and experience, 2019, the Maharashtra Association of Physicians of India invited me to a lecture. It was first presidential oration called Witnessing 4 Decades of Clinical Medicine. This was the lecture that I had delivered in 30 minutes. It was a lecture which I showed my journey as a resident to becoming a full-fledged consultant till my retirement. I was to retire in 2020, 2019 October I delivered this lecture. So I witnessed. See, when I was appearing in my MD, there was a short note on CT scan. So it was an unheard terminology, and they asked this question on CT scan in recent advances. So that also I have seen. Then came MRI, then came ultrasound. I saw it even only after my MD. Now ultrasound has become so routine that it is possibly superseded even X-ray chest and decision making. Biochemical tests we have seen, they have gone to any extent. Now we have even genetic markers which exactly pinpoint why this gentleman got the disease and others do not get the disease. So I think it is a long journey which has evolved over a period of years, and I have witnessed this in last 5 decades.
Good afternoon, sir. How have you managed to maintain a work-life balance throughout your career? What strategies have worked best for you?
I think I am poor at that. Most of the time, it was difficult to keep the balance between the two, because work was tremendous. Work here also was tremendous, and before that in government was still more. So I think reaching somewhere late in the evening, I always tried to start from my office at 5:30 in the evening. There used to be calls from Dean's office that there is an urgent matter pending, so come. So another hour or so gone, and then used to drive to my house, tired. It was very difficult, but to whatever extent, Saturdays of course were also not free. Sundays I tried to spare some time for my family, but that was not sufficient. I agree that I was finding it difficult to keep even today, because I reach here at 10 o'clock, reach back at 6 o'clock. Not many options are left, except on Sunday. And Sundays what is happening is, every Saturday, Sunday, I'm involved in so many bodies in town. I'm vice president of Associations of Physicians of India and Pune, and the president of Gastroenterology Society of Pune. So we have a lot of updates, CMEs on Sundays, so I'm finding it even difficult to give time on Sundays to family. I do try. Last week I was in Europe. I think I just escaped just informing Dean that I'm going away. Otherwise it is very, very difficult.
So what advice would you give to the newly joined residents or who are about to join the journey in the field of medicine?
No advice. I think these 3 years you have to work hard. There is no shortcut to hard work. Reading and work hard, both are important. In our times, I'll tell, reading was less important, working hard was very important. Here, our textbook of medicine used to be about 800 pages or so. It was Price's textbook of medicine. Now Harrison has 2 volumes, and there are many more books. And not only you have to work hard, but you have to read hard also, because reading hard also helps you in going ahead with your super specialty examination. So work in 3 years tough life, another 2 years possibly till you establish yourself as a consultant. Otherwise, I will very strongly suggest that doing a teacher's job is a very dignified profession. After your post-graduation or super specialty passing, joining as a teacher gives you some time for work-life balance, which I could not give, but you may be able to give. And I think you can do a lot of justice to overall life.
What motivated you to join Relive Patil Hospital after your retirement, sir? And how far has your journey been?
I think it was an accident. I tell you, I had an appointment order, I think very honestly telling, that I had an appointment with Kakrani Medical College. I was to join there. The salary offered that time was highest to any teacher. I actually started with my wife and my son. We went towards Navle. I just missed the turn where Navle you had to turn on right side. And then there was no way ahead. I had to go 5-6 kilometers ahead to take a U-turn to reach Navle Medical College. And then my wife and son told me, I think this is not the college, because you are going to drive. You will get confused every time. Better join some place nearby. So I had a mentor here in the medical college, Dr. D.L. Ingole, who was the founder dean of this college. He was always behind me that you join this college. By that time he had retired. So I told him, sir, I have retired, I have joined, I have accepted Navle's appointment, but do you have an opportunity here? He took me to Dr. P.D. Patil immediately. P.D. Sir told me, though we have no vacancy, but once Ingole Sir is told, I am appointing you. I thought my life will be easy here. I accepted the appointment at whatever salary offered. By afternoon, Dr. Amarjit Singh was the dean that time. He gave me another letter that you are appointed as head of the department. I think that was the biggest shock. I thought I'll be a relaxed person here, but that was not going to happen. So I became head of the department, which I remained till my retirement here. Then after about 1.5 years, when the retirement age was 65, Dr. Amarjit Singh was here. P.D. Sir called me again. He told you become dean of because he's retired. So I told him, sir, this is one assignment I will not accept. You give me any academic assignment, I am happy. So after about 3-4 months, it so happened that the dean of medical faculty that time was professor of anesthesia, left this college, and again P.D. Sir called me that I am appointing you as dean of medical faculty, which I happily accepted. So I was dean of medical faculty for almost 9 years till my retirement, and I did my best whatever I can improve in the academic part of the story. I faced 2 NEC inspections, I faced so many other academic developments. Many regulations were made for DPU because DPU was a nascent, newly coming university. We brought this to a level. I have a very small but definite contribution to that. So I did my best for DPU.
Sir, are there any particular figures in your life who have inspired you throughout your career in medicine? Basically, or in other fields who have inspired you throughout your career, sir?
No, obviously you are always influenced by your teachers. So I did my MBBS and MD from MGM Medical College, Indore. So person who influenced me most was my professor of medicine, Dr. G.C. Paha. I was so motivated that I decided that I should be in medicine. And one episode in my internship made me to go towards medicine. When my third year, when I was doing internship, a lady called Dr. Galdari, she was third year surgical resident, gave me a breast abscess to drain. And it ended up with a disaster. I left the knife, I left the blade inside the breast. And she shouted at me, she told, don't try to become surgeon. So I decided that I should not be a surgeon, I should be a physician. And already I was motivated by my professor, so I went to medicine and I never repented after that. I have heard some very prominent people in India who influenced me in my initial days as lecturer. I heard Dr. Ramalinga Swami, who was founder director of ICMR, one of the very senior authorities, and that influenced me so much that I thought we should also do a part of research when we are as a clinician. So that was one. Then one person who influenced me for almost 7-8 years, he was our board of management member, that was Dr. P.S. Hegde. He was vice chancellor of Manipal University, professor of medicine, a prolific speaker, a very knowledgeable person. He will quote book's name, page number by heart, and I think I didn't find anybody close to him. He's still there, but because of some health issues, he's not that active now. But I think I salute to him right now also, that he made us think that you had to be perfect in your subject. So he was one last person that I was influenced. So.
Sir, tell us what are the sir here. Yeah. what are the opportunities for undergrads and post-graduation students outside India? What are the opportunities?
I think you should try to be in India. But I think opportunities in US are plenty. Opportunities in clinical sciences and also in the research. I think most of the students I observe here are more interested in going to clinical branches. We have made a small contribution towards that. We have a tie with Johns Hopkins University. We provide 4 seats to our students bypassing the PSLO channel. So they are happy to give. I even requested them to give us more opportunities. They have at least agreed to give us more research opportunities. So I think going to US is one opportunity. And I have done my clinical epidemiology training there. I tell you, that is one country which respects your ability irrespective of your caste, creed, religion, and this unique country in the world. And that's why they get the best brains of the world in that country. Another country I think where you can go because of advantage of English is UK. UK, you have to go through the PLAB channel. UK used to have some discrimination component. All my colleagues who were there, I had got my General Medical Council registration because my batch, there was no exam. My MD or my MBBS gave me direct entry into UK. I got General Medical Council's registration directly, but because of personal reasons, I could not go to UK. Now you have to go through PLAB, but that is one country where the clinical practice is ethical, though slow. A patient falling ill with chronic illness has to wait about 3 to 6 weeks before he could be examined by you as a consultant. So that is one, but they are good, they are ethical. They are not willing to give you so much opportunities in initial period as US will give you, but if you prove yourself, they will also give you opportunities. These 2 countries, yes. For going to other countries, particularly in Europe and South Korea, I think there are a lot of research opportunities. If you are interested in molecular sciences, genetics, and things of that sort, I think these countries are wonderful. So Europe, Germany, particularly Germany gives a lot of opportunities. France also gives. And South Korea, yes, they accept Indian students, but it is largely for research.
Good evening, sir. Your contributions to Hutchinson's clinical methods is highly regarded. What were your contributions to the book, and how do you feel your input has impacted clinical medicine?
See, I had the offer of editing Hutchinson's book for somewhere in 2016. They offered me first time. They gave me 2 topics. One was approach to a patient in emergency. That was okay because I have been dealing with emergency. The second topic they gave me to revise from the earlier edition was ear, nose and throat. I had no connection with ear, nose, throat in my profession. But I went through that topic. I talked to my ENT colleagues and I asked them, could there be any suggestion? I could hardly make any recommendation. But for emergency, yes, I did suggest them when they were incorporated in the editions later.
Sir, have you held any positions in medical associations or committees, and how have these roles influenced you in perspective of medical professions?
I have been holding positions in various bodies. I am a life member of Association of Physicians of India. They awarded me fellowship of Indian College of Physicians, which is a rare. I think in this college I am the only one who has been awarded the fellowship of Indian College of Physicians. So there are only 6 or 5 people in this town, Pimpri, Chinchwad and Pune together, who are fellows of Indian College of Physicians because of my contribution to Association of Physicians. Then I am a life member of Indian Society of Gastroenterology and almost president emeritus of that society. 15 years I am holding that position of president of Indian Society of Gastroenterology, Pune branch. That is one, and I am vice chairperson of Association of Physicians of India, Pune branch. As a gastroenterology head, I have organized 2 conferences as chairman at state level. As Association of Physicians vice chairman, I have organized the state conference somewhere in 2022 after my retirement as professor of medicine. So I have been associated and actively involved in the work associated with various associations. I am now member of IDSA, Infectious Disease Society of America. I have been contributing to them in some way. I have been also member of Clinical Infectious Disease Society of India and also Critical Care Society of India, but I am only a member. So whatever work they assign, I try to do.
Thank you so much, sir. Good evening. Sir, here. Sir, during a large incident, sir went for 6 movies straight in a day because he had a bad day in college. Any such experiences with you?
Not really. I had different type of experiences, but
Yes, sir.
I think I did not get. I think my deans were very polite, including the current dean. I was always respected by my deans as a student and in my job. But I had certain incidences in my life which I will not forget. There were some occasions. I remember I was a associate professor in Government Medical College, Miraj. So I always believed in teaching when standing, and all students should also be standing. Here we all make the students sit. I also sit on chair because I have grown old now. I prefer to sit. So I found one student with a very dirty shirt and slippers in his foot, and we were taught in medical college, and Dr. Bhavardhan will agree that medical students should be in shoes, clean shaven. So I fired this student that though you are answering well, but how are you poorly dressed? So he kept quiet, he didn't tell anything. After the class was over, he came to me. Sir, you told me what you told is right, but sir, do you know my background? My father is a farm laborer. He could not afford anything. Only because of scholarship I am surviving here. So whatever I get from my relatives, friends, I wear. I continue my medical education. Most of my books are hired from library. I think that gave me a lesson that respect everybody, rich or poor. Sometimes those poor people could be more brilliant. That boy became a medical officer because that was his family need. After passing MBBS, then he did MS surgery in medical officer quota. He is not only a successful surgeon, but also a good Marathi writer. He keeps on sending some poetries and stories to me. So I think that one thing that impacted my life very clearly. Second one, in Sassoon, I used to do a lot of endoscopies. So I remember I used to do sclerotherapies for esophageal varices, massive patients coming to us. And before the bending was standard of care, we used to do sclerotherapies for those varices from esophagus. So I was doing esophageal bending, esophageal varicose injection. So I did 4 or 5 on one patient. He used to come every time from Kolhapur. So I told him, now I think your sclerotherapy is over, you did not come. But he came next time also. And I told him, why did you come to me? Your sclerotherapy is over and most likely you will not bleed again. So he told, sir, I have brought you a pair of chappals. He was a chappal maker in Kolhapur, and he told, sir, this is for you. So I actually wore it and it was exactly fitting to my size. So I told him, how did you find that my size is correct? He told, sir, I looked at your feet, though it was in shoes and covered with the gloves, but still I could judge and make it for you. So I realized that doing honest medical practice is very important. You do not know which patient will be almost like a god to you. I think his blessings could be still helping me somewhere in my life. And one more. This is Diwai Patil's story. Another sclerotherapy girl, 8 years. And when I was here, I think it was 4 years back, mother of that girl came and met me. Sir, the girl whom you did sclerotherapy is still doing well. She has come with a pregnancy and is going to be delivered by Dr. Deshpande here. So I think something that touched my heart again, that what you do unknowingly sometimes makes so much difference in your life.
Sir, what is your opinion on what is your opinion on medicine shifting from clinical to evidence-based? Should we adapt to the new situation?
Yes, I think you should go to evidence-based medicine, but you should not forget clinical medicine, because there is no shortcut to clinical medicine. You can get 90% of the work on investigations and laboratory support, but 10% there is always a surprise. Again, I'll tell you a story. Number one cardiologist in Pune. We used to send cases to him from Sassoon. His technician used to record echoes in the evening, somewhere 8 or 9 in the night. He will see the echoes on the recorded screen and give the diagnosis. So he wrote in one patient, his echo normal. So I phoned him somewhere around 9:30 in the night. Sir, dear doctor, you have written this echo is normal, but she has mitral stenosis. Don't you find the evidence? He told, immediately send her. Well, I cannot send her at 9:30 in the night. He told that I am sending my car, send her. I will see the echo. He was still in Ruby Hall that time. And he did echo and he wrote, I am sorry, I missed a clinical finding. I only relied on echo. I think this gives you a message that clinical science, though it is a dying art, it should not permit it to die.
Good evening, sir. Sir, how was your equation with your roommates and your friends in UG and PG? And are you still in touch with them?
No, I see. I was we used to call that time as a day scholar. I don't know what is the term used here. So people in the city were called as day scholars. So I always stayed in my home. Except during my MD, I had a roommate who was also doing MD medicine with me. He was son of a district judge that time, and he was very nice. And we all studied together for MD. All of us passed MD, and they were very helpful. That was the time. There were a lot of difficult time, which I am telling you. This was 1975 when there was an emergency in the country. We used to have knocks at our doors. Somebody coming in, searching our rooms. Are we having some weapons, rods, or anything? So anyway, that was a different part of the story. That roommate later became head of a religious sect called as Gayatri Parivar. It is in Haridwar, and he leads a family of Gayatri Parivar of many millions of people worldwide. He is Dr. Pranav Pandya. He is he is chancellor of a university in Haridwar. So that was the only roommate I had.
Good evening, sir. Good evening, sir. Good evening, sir. Sir, your contributions to research are exceptionally noteworthy, with citations of over 1700 and a stellar age index of 19. What would you like to recommend to students who would someday aspire to be a physician scientist like you? Thank you.
Always find time for research. I think this is important. Important for personal development first, and also for your institution. So personal development, yes, my my publication record gave me an easy entry into medical colleges wherever I applied. So that is important. It always gave me more opportunities for giving. I got FOBATI grants from US government only because of my publication records. So I think you have to do publication if you have to progress in life. Though you may be a successful practitioner, even I know very successful practitioners also tell me sometimes, sir, why don't you make me an adjunct professor in your college? I can contribute my knowledge to this institution. So always try to do some research. It will give you an added advantage wherever you go.
Sir, we have always heard during back your time there was always the culture of ragging by the senior. So, have you ever had that incident?
Yes, it's very bad. I can't describe it. It is difficult to be describing in the language that the experiences that I feel. And I was asked to drink alcohol, which never I drank later in my life. I was asked to smoke, which I never did later. And so many other things that I cannot describe you. But we were caught. From my college to home, there was only one route, and there was a hostel called Bafna Hostel on the way. And some of the seniors used to be on lookout like a shikari waiting for a hunt. So they used to catch andar chalo, and then everything else used to start. I think it was a terrible experience that nobody should ever experience that sort of a thing in life. I think I'm so happy that it doesn't happen here.
Sir, is there something that Dean Sir would like to ask to Kakrani Sir?
Sir, now you are here for last 20 years with the Patil. How you find the quality of the students as you have worked in the government college and the private sector?
No, I found that the quality of students is good even before NEET era. Although some students were good, but after NEET era, I think the student quality has significantly improved. Some of them are as good as government colleges. Some of them have come by their choice, though they might have got admission in government colleges. I am aware of some such cases individually also, that their parents wanted them to be in Pune, their parents wanted to be in big cities. So students are good. Maybe they need little more effort on the part of teachers to give them guidance. I think that, and I have seen that makes a lot of difference.
Right, sir. But then my next question is how you see this institution and these children as alumni maybe 20 years ahead.
I want to see them becoming heads of the departments of some American universities, some British institutes. I think it started happening. Some of our students have become assistant professors, and one of them is at the verge of becoming associate professor in rheumatology. So this has started happening. Someday I find this will happen when they will head the departments and they will acquire distinguished chairs in those universities.
Right, sir. So this is the path sir has shown, and really I'm sad that you grow and maybe 20 years later would like to see many of you heading departments of research, medicine and excellence. That is our wish. Thank you, sir.
And our deepest gratitude to Dr. A.L. Kakrani Sir for sharing his invaluable insights and experiences with us today. Your contribution to the field of medicine and medical education continue to inspire and guide us. Now I would like to invite Gulshan Sharma, General Secretary Student Council, for the vote of thanks.
I would like to thank Dr. Patil Sir, Trustee and Lecturer Dr. D.Y. Patil Medical today, and our beloved Dr. J.S. Bhavalkar Sir, Dean Dr. D.Y. Patil Medical College, today for making this very event possible and providing us a platform to have such interactive sessions. Special thanks to Dr. A.N. Kakrani Sir, Director, International Academic Collaborations, Dr. D.Y. Patil Medical College, Pune, for sparing your time and enlightening us with your experiences, sir. Thanks to all the residents for being such an amazing audience. And finally, thanks to the management and Students' Council for organizing this College Katta 2.0. Thank you.
Snacks.
Also, the management has prepared some snacks and tea for everyone. So before leaving, please do join the table.